What you're looking for, there are certain red flags, especially when you're thinking about hereditary breast cancer. I'd say the number one red flag that do not miss a high-risk feature would be age at diagnosis. So any breast cancer diagnosis under the age of 50 should be in and of itself a red flag where a provider should think about sending their patient for cancer genetic counseling and potentially testing. And that would be true if that's a patient sitting in front of them with breast cancer, or if it's, say, an unaffected healthy woman but whose mother or aunt or grandmother, a first, second, or third degree relative with the same early onset breast cancer. Even if that woman sitting in front of you is healthy, that's enough of a family history to consider testing, or at least counseling. So certainly early age of onset of breast cancer, any ovarian cancer in the family at any age in a first, second, or third degree relative is something to think about. Clustering of certain cancers in the family, so breast and ovarian together in the same family, breast and pancreatic in the same family. When I think about BRCA1, BRCA2, and the other genes, I think primarily about breast, ovary, pancreatic clustering together. And there are other syndromes that we're finding on these panels that may or may not be related to breast cancer at all. Something like Lynch syndrome, where colon, ovarian, uterine cluster together. So sometimes you see clusters of syndromes that may or may not relate to the patient sitting in front of you. But when you gather a family history, it's important to ask about not only mom's side of the family, but dad's side of the family. Ask about brothers and sisters and mom and dad, but ask about aunts and uncles, ask about cousins, because you want to know an extended 3-generation pedigree.